Hi everyone, my name is Tiffany Cougle and my nursing research critique was on the effects of music therapy on anxiety of patients with breast cancer after a radical mastectomy, a randomized clinical trial. Our research problem and question are that the problem is breast cancer patients have high anxiety after a radical mastectomy. Our research question is, can music therapy help to decrease or eliminate anxiety for these patients? Our purpose is to evaluate the effects of music therapy on patients who have had a radical mastectomy. For this critique, we had two hypotheses by the research. The first one is patients in the experimental group will have a reduction in anxiety after music therapy compared to the patients in the control group. The second hypothesis is that the treatment effect changes with follow-up time, examples meaning there is an interaction effect between treatment and follow-up time. The nursing problem significance. This problem is significant to nursing because patients with anxiety can need extra healing time and other psychological disorders. As a nurse, we need to be able to help our patients not only physically but psychologically as well. The study design is a randomized clinical trial. There was an experimental group and a control group. The control group was not given any information about the music therapy. They did not complete the post-test or pre-test, and they only received routine nursing care during their stay at the hospital. The experimental group had received information about the music therapy. They were allowed to choose the music that they wanted on the iPod they were using. They received music therapy twice a day, once in the morning between the hours of 8 a.m. and 11 a.m. for 30 minutes, and once in the afternoon between the hours of 9 p.m. and 11 p.m. for 30 minutes. The model used in this study was core, care, and cure model. The core was talking or referring to the patient and the patient's state of mind. The care is the patient's body. And the cure was referring to the nursing behaviors, which meant any type of possible procedures or medication administrations during the patient's stay in the hospital. The variables in this study are the dependent, which is referring to the patient's anxiety. The independent is the music therapy. We also had research variables, which included age, occupation, level of education, number of kids, marriage, and income. The intervention was that music therapy was provided twice a day for patients in the experimental group. As far as the sample goes, the sample size was 120 female breast cancer patients who had to have a radical mastectomy. The inclusion criteria included that the patients needed the radical mastectomy, they had to attend chemo or radiation therapy after the mastectomy, they had to complete the demographic questionnaire, as well as 1 pre-test and 3 post-test of the SAI test, which means the State Anxiety Inventory test. The exclusion criteria is that the participant for any reason decided no longer participate in the music therapy, or if they did not complete the 1 pre and 3 post test for the SAI scale. The sample setting was on the Oncology Center in a general hospital in Zhang, China. Ethical components. This study was reviewed and approved by the appropriate Human Research Ethics Committee. All the participants had gotten a written explanation about what the study was about, as well as having to provide written consent to be in the study. Data collections procedures include that all participants were given an explanation and given written consent to be in the study. Only permission was received. Once permission was received, the demographic questionnaire was given out, as well as the pre-test for the SAI scale, which was done before they had a radical mastectomy. The 3 post-SAI tests were one was given right before discharge and the other two during radiation/chemotherapy treatments afterwards. The results are that music therapy does help to lower anxiety in breast cancer patients that have received a radical mastectomy due to undergoing a lot of stress and other psychological components. Music is able to help calm. Limitations of the study include, and that were identified by the researchers, include that all the data was self-reported, so there could have been some bias as far as defensiveness, misinterpretation, personal emotion, and other attitudes. Another limitation is that this study was done in Ziyang, China, only included one hospital and a small sample size. All the patients had to have the radical mastectomy before receiving chemo or radiation. Only quantitative data was collected for this study. Usefulness and applicability to nursing would include that music therapy can be used as an alternative way of improving anxiety in female breast cancer patients after having a radical mastectomy. It will benefit a large number of patients in China and can be generalized for the clinical practice and include life statistic and well-being. Music therapy can benefit many patients that have cancer, but further research would need to be done on that. Decreasing a patient's anxiety can help in their mood stability, their psychological state of mind, and the acceptance of their medical diagnosis. The conclusion for this critique would include that music therapy can be a great way to help reduce anxiety. Once we've reduced anxiety, we can reduce healing time and we can have better patients. Thank you.